So good afternoon, everyone. Thank you for joining us today. This is the Mahwah Township Public Schools 2025 Open Enrollment presentation. My name is Elizabeth Roldan, and we are the insurance broker for Mahwah Township Public Schools for IMAC Insurance. We are here to help you with any questions that you may have related to your health benefits, including medical, prescription, dental, and especially now during open enrollment with any questions that you may have about the plan that you're currently in and what your other plan options are as well. We are also here to help you out with any claim problems that you may have. So please feel free to give us a call. We actually would prefer that you reach out to us probably first because usually it'll take a little bit longer. You'll be on hold time with Horizon or Benecart or Delta Dental, depending on which coverage you're inquiring about. So we do encourage employees to reach out to us directly so we can get you an answer quicker and in real time, especially if you're waiting on a pre-authorization or maybe if you're having trouble picking up a certain prescription at your retail pharmacy. Employees can reach out to us by calling 973-450-9800, or you can send us an email at info@imacagency.com, and we will get back to you, especially now during open enrollment. We are very big on getting back to people within the hour or at least within that morning to ensure that you have your answers in order to make your open enrollment decisions. This open enrollment, which is a passive open enrollment, is beginning today and it will be running through December 3rd. Any changes that you're looking to make on any of your coverages would be completed on a paper form, depending on the change that you are requesting. So if you're looking to make a plan change, for example, I know one of the questions that we've been getting a lot is plan differences and the cost differences between Direct 10 and your educator's plan. Any of those changes, for example, if you're moving from Direct 10 to the educator's plan, you would need to complete a Horizon form for the medical and the Benecart form for prescription. And we are going to be covering those two plan differences quite heavily today. But if you aren't making a plan change or you aren't making any changes related to your dependents, there is no action required as it is a passive open enrollment. We do, however, encourage everyone to go ahead and review their plan elections and to ensure that their dependents are correct. I would also encourage you that if you've moved, that you please update that information with the Human Resources Office, because if you are making a plan change, what we notice is that before the plan takes effect in January, and you call us a few days before the plan's effective date and tell us, hey, I didn't get my ID cards, we may not have your updated address on file. So it's very important that if you have had an address change, that you update the Human Resources Office, and if you're making a plan change, to include that on your enrollment form as well. If you are looking to waive your coverage, you do have to complete and submit a waiver form. I believe that was emailed out to everyone, but if not, we do have it on the IMAC benefits portal. And really a lot of the forms, all of them, I should say, all of the forms, contribution calculators, and anything and everything related to your health benefits, we have it all in the IMAC benefits portal that is custom for all Mahwah Township employees, Mahwah Township Public Schools employees. So if you haven't accessed the IMAC benefits portal yet, we did reference it at the top of the meeting, but we do have a slide coming up about that, so you just know where to access that. And if you are looking to make a change for your flexible spending account, that enrollment occurs in May with changes being effective in July. So we just wanted to make mention of that. During this open enrollment period, there are 4 plan options that are being offered, which are Direct 10, your NJ Direct 15, your educator plan, and the Garden State Health Plan. For employees that were hired before July 1st of 2020, they can elect from any of these 4 plan options, but employees that were hired, on or after July 1st of 2020, your only 2 plan options are the educators or the Garden State Health Plan, and that is per Chapter 44 law in the state of New Jersey. We do have detailed plan comparisons of all 4 plans on the IMAC benefits portal, as well as plan summaries for them. I know that as we talked about a little bit ago, a lot of employees have been reaching out with questions about plan differences and cost differences related to Direct 10 and the educator's plan. And one of the questions that we get is, how are the contributions calculated? So if you look all the way on the left of this slide, you'll see that Direct 10 and Direct 15 are based on what's called Chapter 78. So they take into consideration the coverage tier, so whether you're enrolling single, two adults, family, parent, and child coverage, your salary, and the premium of the plan. So those three components determine what your per pay contributions will look like. The New Jersey Educators Plan and the Garden State Health Plan, however, are based on the law that was passed in 2020 called Chapter 44, and only your coverage tier and your salary are factored into that contribution. So as you can see from this, the premium is not factored in at all because you are contributing a percentage of your salary rather than a percentage of the premium when you're looking at the Educators or Garden State Health Plan. And that is why you have a guaranteed savings by moving into both either of those plans. There are plan differences. We are going to be covering those details today. And all the plans are not one size fits all. I have conversations daily with employees that we review how they and or their families actually utilize their benefits to see if either of these options are a good fit if you're coming from Direct 10 or Direct 15. Um, we do have a contribution calculator on the portal that we have a slide about as well. But if you want to reach out to us and go over what those numbers would be if you stay in, let's say, Direct 10 versus what you would be saving if you move into the New Jersey Educators Health Plan. So there is a big difference in how those calculations are determined. For example, in the New Jersey Educators Health Plan, if you are someone who, let's say, earned $75,000 and you have a family plan, you would be contributing 5.5% of your salary by moving into that plan. And again, compared to the Direct 10 and the Direct 15, you would be saving money moving into the educator's plan. And every year that the premium goes up in the New Jersey Direct 10 and the Direct 15, you are contributing more because the premium goes up. Whereas in the educator's plan, the premium does go up every year, but because it's based on a percentage of your salary, you are not seeing those increases unless you have a salary change. Same thing with the Garden State Health Plan. They have their own table of contributions. So again, using that example of $75,000 as your base salary, if you have a family plan, you'd be contributing 2.75% of your salary. But again, really big plan differences, which leads us to our next slide to highlight the plan differences here. So all four plans that are offered during open enrollment have the same network of doctors. In the state of New Jersey, that network is called the Horizon Managed Care Network. So any providers that you have in Direct 10 or in Direct 15 right now will be in the same network for the educators or the Garden State Health Plan. The Garden State Health Plan, however, only has coverage in the state of New Jersey. So that's a big takeaway, and that's a big point of consideration that we like to highlight, especially in bold here, because if you are someone, especially based on where Mahwah Township is actually located, you may be an employee that lives right across the border in Suffern or in New York State, or you may be an employee that utilizes providers in New York City, for example. The Garden State Health Plan is not a good option for you because you will not have coverage outside of the state of New Jersey. So that is a big, big takeaway. We usually, what we see is employees that are looking to save on their contributions. If they're in Direct 10, they're usually moving into the New Jersey Educators Health Plan because the Educators Plan has the same national network as Direct 10 and as Direct 15. As we mentioned, the contributions for the New Jersey Educators Health Plan and the Garden State Health Plan are calculated as a percentage of your salary rather than a percentage of premium like Direct 10 and Direct 15. Your co-pays are $10 for either Garden State or the New Jersey Educators Health Plan. Your specialist copay is $15. Your emergency room copay is $125, but it is waived if you're admitted into the hospital the same way that it is under the other plans. The two key differences with the New Jersey Educators Health Plan or the Garden State Health Plan is the out-of-pocket costs if you utilize out-of-network doctors is higher. And we're going to get into more specific detail about that. So if you're someone who is considering moving to the Educators Plan, for example, and you're going out of network with a high degree of frequency, that's a red flag to pause and consider, before you move into this plan. Same thing with prescription. The prescription plan for the educators and the Garden State Health Plan is different, as it is a smaller list of covered medications with a mandatory use of generic drugs wherever possible. And we are going to be getting into a lot more detail about those two key differences. So just to go over all four plans in a little bit more detail as far as how do they compare to one another, as we mentioned in the state of New Jersey, the network is exactly the same. So again, that Horizon Managed Care Network, but the national network is only applicable to the Direct 10, 15, and the Educators Plan, as the Garden State Health Plan only has coverage in the state of New Jersey. Your co-pays for primary and specialists, as I mentioned, vary depending on the plan that you choose. And your annual well visits or physicals are covered in network at no copay across the board in all four plans. Each plan has its own deductible and annual maximum out of pocket. It varies depending on the plan, but the deductible, which is the amount of money that you would lay out before the plan begins to provide coverage in network, none of the plans have a deductible. So the moment your coverage begins, your plan will start paying out if you stay in network. If you go out of network, your deductible is applicable depending on whether you have single coverage or whether you have family coverage. Same thing applies for maximum out of pocket. You have different limits in and out of the network, and maximum out of pocket is the most that you would pay out in a calendar year. And you have, again, those limits in and out of network. None of the
Elizabeth,
plans. Yes, please.
I'm sorry if I
Yes.
could ask a question. This
Yes.
came up. I received a direct inquiry about this. The max out of pocket. So what is the difference between an individual plan, a single plan, or an employee plus a spouse or partner? So I know there's
So
a difference between single and family, wondering what the difference is with those other plans.
So the deductible is applicable to two or more members on the plan. So in the case of a family, only two members would meet the maximum out of pocket or deductible. And in the case of a plan that is just two adults, for example, each person has their own maximum out of pocket or deductible. So I'll use Direct 10, the maximum out of pocket, which for an individual is 400, for a couple or a family, it's 1,000. So in order to satisfy, for example, Jane and John Doe are married. If Jane is the one that meets the $400 deductible, her coverage is in network, her maximum out of pocket at that point is satisfied. Everything is covered at 100% in network because she met her maximum out of pocket. If John would have to meet his own 400, but again, because it's two or more people that have to meet it. So whether it's a couple or a family, that's how that works. So two or more people would meet it in that situation. But if only one person is the one that's really driving the cost there, that really needs that is really utilizing their plan like that, if they meet their own deductible, their own maximum out of pocket, their specific coverages moving forward would be covered then 100%, whether it's in or out of network. So I
Thank you.
hope that answers that.
Yep, thank you.
Yeah, perfect. So the referrals, there are no referrals required for any of the four plans. Your labs across all four plans are the same, with LabCorp and Quest being your in-network labs, and your out-of-network labs or imaging or anything of that sort would be subject to the applicable deductible and coinsurance. One of the things that I like to mention when we talk about blood work is a lot of employees tend to get their blood drawn, maybe not at a LabCorp site, but maybe at their doctor's office. Your doctor, if they are in network, should know where to send it based on your plan's information. It does not hurt to mention to them, hey, my covered labs are LabCorp or Quest. So that's something I like to highlight to employees because it has happened where it'll be sent to a non-participating lab. The employee then reaches out to us and say, hey, my blood work wasn't covered. Can you help me? And that's because the doctor didn't send it to the right place. So that happens. Outpatient surgery, there is no charge if you stay in network. Out of network, again, you're subject to your applicable deductible and coinsurance. And as you can see, whether you're in the educator's plan or whether you're in Direct 10, where employees are saving the most money is when they stay in network, because when you stay in network, that means that you're going to a provider that is contractually obligated to either cover that service at 100% or only bill you for your applicable copay. When you go out of network, those doctors have no contracts with Horizon. They truly can bill whatever they want. And unfortunately, it's the member that ends up footing the bill because Horizon will say, hey, this is what we would have paid if they had been in network, and we're not going to pay above that. So, and we do talk about out of network coming up, but it's a good point to mention that now. The emergency room, again, is applicable. Your emergency room copay is applicable to the plan that you choose, but again, waived if you're admitted into the hospital. So as we begin to talk about out of network, that's something that, especially in the educators and the Garden State Health Plan, is something to be incredibly mindful of if you are looking to switch into any of these two plans. And as I mentioned, in network, doctors have a contract. They can't bill you above what that contract language states as far as a copay or if the service is covered 100%. But when you go out of network, you are really subject to pay a lot more than you would in network because that doctor doesn't have a contract and they really can bill whatever they'd like. And if they bill above what Horizon would be covering, that is what is known as balance billing. And you as the member would be responsible to pay that difference between what Horizon reimburses you and what that doctor is billing in whole. The table that is used for Direct 10 and for Direct 15 to determine what to reimburse out of network doctors is a table called Fair of Health. In the educators and the Garden State Health Plan, however, they utilize the Medicare table to determine what to reimburse those out of network doctors. So if you know anyone who's ever been on Medicare or a parent, for example, the out of network reimbursement using the Medicare table is a lot less than the table used for Direct 10 and Direct 15. I personally just spoke to someone the other day who was considering moving into the educator's plan. She goes out of network 3 times a week for a therapy session. And I flat out told her this is not a good option for you because while she will be realizing a nice chunk of savings moving into the educator's plan, that's going to be eaten away by the higher out of pocket costs that she will have now because she has a high degree of utilization with out of network providers. So again, something to consider if you're already going out of network weekly, biweekly, etc. It's something to consider. On the flip side to that, I've also spoken to employees who go once or twice a year to a specialist out of network. And again, they're still coming out ahead of the game savings wise, even if they have to pay a little bit more because they chose to see this out of network doctor a couple of times a year. And this is an example that we like to put together with respect to out of network. So let's say under the educators or the Garden State Health Plan, you go to a provider out of network. That provider bills, let's say $100 for that service. Horizon will take a look at that and determine based on the CPT code for that out of network doctor and the location of that doctor, what they would have covered as what they consider usual, customary, and reasonable allowed charges. And in this case, let's say that they determine that that service and network should have been billed at $50. Verizon in the blue box will go ahead and pay out their 70% of coinsurance, which is $35. You as the member would pay your 30% in coinsurance, which is the orange box for $15. But that other $50 that we haven't even touched upon yet in red, that is what is known as balance billing. You as the member would be subject to pay that in order to pay that bill in full for that provider. And while this is a very high level hypothetical example, usually what we see when people go out of network, it's because they're going to a certain specialist, usually a much higher bill in the hundreds or even thousands of dollars. So that's why it's so important to really understand, are you going to an in-network or out-of-network doctor? And you as the member have that right to go ahead and ask that out-of-network doctor before a service is rendered to give you what's called a predetermination of costs, what they would bill, what they anticipate will be reimbursed, and what your out-of-pocket exposure could be. So you have all the facts in front of you before you go ahead and make the decision to uh, say yes and have a service provided by an out-of-network doctor. We have these conversations all the times with members. Please reach out to us because our goal is to really make sure that you're properly informed and educated on all of your options for open enrollment. And when you make a plan change, you are committing for the entirety of 2026. So the last thing that we want is for a member to be enrolled in a plan that's not going to cover the providers out of network that they're already seeing or moving into prescription, that the prescription is working for you, that the drugs that you are on will continue to be covered in the same way that they are now, if that's what you need to be on. So with that said, the educator's plan, again, still with Benecard, utilizes a different list of covered drugs. It's a smaller list than the list used for Direct 10 and for Direct 15. And the list for the Educators and Garden State Health Plan includes a mandatory generics requirement. So, for example, if your doctor writes a prescription for Crestor, which is a brand name cholesterol medication, Crestor is not covered under the educator's plan because it has a lower cost generic option available, which is called rosuvastatin. So if you are on medication right now that you and or your family need to be on for the foreseeable future, reach out to us. We will go ahead and connect directly with Benecard to let you know how those drugs would be covered should you move into the educators or Garden State Health Plan. What I tell people is the the plans will cover every a drug for every single condition. So it's not like if you are asthmatic, the plan says no, we're not covering inhalers anymore. No, there is coverage for medication for every single condition, but it may not be the one that you want to be on or that your doctor wants you to be on. So that's why it's important to do that due diligence research before you move into a plan that has these restrictions to ensure that it's going to continue working for you. Ideally, what I tell people is that if you don't have a problem staying in network and you don't have an issue with generic drugs, the educators or the Garden State Health Plans are great options because they're going to save you a lot of money, especially the higher salary that you are with your payroll contributions. But again, as we've highlighted over the last slides that we've covered, there are plan differences moving into the educators or the Garden State Health Plan that we like to forewarn people about that they're different. I know at Mahwah, as well as at a lot of school districts in the state of New Jersey, the plans have been around now for 5 years, the educators and the Garden State Health Plan. And in a lot of districts, they're incredibly popular options. But again, just making sure that you do that due diligence before you make that change. And I mentioned it before, but if you have any questions, please feel free to put it into the chat right now. I am looking at the chat just to make sure that I'm covering any questions that you may have. So next steps. If you aren't making any changes to your enrollment, you are not required to complete any forms. But again, we do encourage you to take a look at your current coverages and dependents to make sure everything is accurate. If you are looking to make changes or waive your coverage, you would need to complete the applicable form, whether it's the enrollment form or the waiver form. Um, and you can utilize the IMAC benefits portal to evaluate all the differences in plans and the benefits, as well as the contribution information. And please remember, you are making an election for the entirety of 2026. This also reminds me of something I like to mention that is kind of a big misconception that's out there. If you are in Direct 10 or in Direct 15 and you're looking to move to the educator's plan, one of the big questions that we get is, well, if I leave Direct 10 or Direct 15, I can never go back, right? And that's wrong. Everything is based on your date of hire. So if you are someone that was hired before July 1st of 2020, you can pick every year during open enrollment from many of the plans that are being offered. So if you leave Direct 10 today, you can always go back to it at the next open enrollment opportunity. But any changes again that you're making now would be for the entirety of 2026. And your next open enrollment period would be next November for an effective January 1st date. Probably the biggest takeaway today is all of your enrollment changes or a waiver form must be submitted to the Human Resources Office to benefits@mahwah.k12.nj.us by Wednesday the 3rd. It's important, that is the deadline for open enrollment. So please make sure that you are adhering to that. The IMAC benefits portal that we've been referencing this entire time is really your one-stop shopping for everything and anything related to your health benefits. It's a great portal to make sure that you bookmark in your browser. There is no personal health information in it. It is all general information about all the plans offered at Mahwah Township Public Schools. And if you go to imacbenefits.com, you will be asked to enter in a guest key, which is Mahwah BOE, as laid out on the screen, and you will see all of the forms that we've referenced, plan comparisons, the contribution calculator, which looks like this, and all of that is posted on the benefits portal. The contribution calculator is in Excel, so you do need Excel 2013 or later to open it. If you don't have that, or if you try and open it with Google Sheets, it will not work. So please call us. We will go ahead, and whether it's via email or via a phone call, we will go ahead and run those numbers for you based on your union's custom Chapter 78 and Chapter 44 contribution schedules for any of the plans that you're considering. So please reach out to us and we will run those numbers for you. And while we know that this is open enrollment, life happens outside of open enrollment. So you do have 30 days to make any changes once you have a qualifying life event. If you have a newborn, however, you have 60 days, which is a New Jersey state mandate. But you do have 30 days if you have a divorce, if you get married, or if you lose coverage, let's say that you currently have through a spouse or a parent outside of open enrollment, you would have that set time limit to go ahead and make those changes, and coverage would be retroactive to the date of the event. So if you get married on September 1st, but you don't get a chance to enroll that new spouse until, let's say, September 15th, that coverage would be retroactive to the date that you got married, which is September 1st. And while this is your annual open enrollment opportunity, please note that it happens every November with changes effective January 1st. For those of you that have dependent children that may be aging out, dependent children age out at the end of the calendar year in which they turn 26, and they have a few coverage options under Horizon and Benecard, which are as follows. They have COBRA, and that's an automatic notification that will be sent out, and an offering made to your dependent child that ages out. If your child meets certain criteria, they may be eligible for a New Jersey state mandate called Chapter 375 or dependents under age 31, which we will get into in the next slide. And if you do have dependent children that are special needs, there is coverage continuation for overage dependents with disabilities. So please feel free to reach out to us to walk you through any of these scenarios, just to make sure that you have all the information you need should any of this be applicable to you. So as we were talking about Chapter 375, it's a New Jersey state mandate that if your child is aging out and they are under the age of 31, if they have no dependent children of their own, if they're unmarried, live in New Jersey, or are a full-time student at a public or private accredited college or university, and that they're not entitled to any other group coverage or Medicare, they would be eligible to continue in the same medical and prescription plan that you currently are in at a much lesser cost than COBRA. If you know anything about COBRA, COBRA charges 102% of the premium. And when I give people those rates, they really get sticker shock, because I've had parents that have asked me if those are annual rates, but COBRA is very expensive. It's probably the equivalent of a mortgage payment. But Chapter 375, if your child meets that criteria, is 60.8% of the premium cost, so much less than COBRA. But again, something available. As we know, costs are also rising with the Affordable Care Act and the marketplace. Chapter 375 may be an option for your dependent child. But again, only if they meet that criteria, and only for prescription and medical. We do have a link with this paperwork on the IMAC benefits portal. So again, please know that it's available there, but also reach out to us if you have any questions about completing that and anything related to that. We also like to mention that the Horizon Doctor Finder search is available on Horizon's website. We also have a link on this on the IMAC benefits portal. And while all 4 plans have the same network of doctors, you may be in a situation where you go to the emergency room, and let's say you, and it's happened with other members. We had a member that went to the emergency room, had a neurological issue, met a doctor there that told them, hey, follow up with me. That what happened was that doctor turned out to not be in network with their specific plan. So it's important to know how to find providers, especially if you're maybe diagnosed with a new condition. You would go to horizonblue.com/doctor finder to go ahead and search for in-network providers under your plan. And again, all 4 plans, the same network of doctors would be available. Also, as a Horizon member, you do have access to Horizon BFit, which is the gym reimbursement as it's commonly known. So if you go to the gym 12 days or more out of the month, or if you do 10,000 steps a day as well, you can earn $20 a month or up to $240 a year to go ahead and be reimbursed just for performing wellness activities like walking or going to the gym. We have a link for this on the IMAC benefits portal, but you can also go to Horizon Be Fit as well to access that and enroll to begin collecting that gym reimbursement. Also, as a Horizon member, you do have access to a whole host of Horizon discounts from anything like LASIK eye vision surgery, meal delivery plans, even weight loss services, or even Skechers sneakers. So if you go to blue365deals.com, you can sign up to get weekly emails from Horizon on all of these discounted services that they offer to their entire membership. We also like to mention Horizon's mobile app, which is great to have on the go if you don't have your ID card with you. It is really the same information that you'd be getting if you go onto the Horizon website, but the Horizon app, again, makes it really easy to just carry a digital copy of your ID card with you as well. With that said, that really does bring us to the end of our presentation. Barbara or Catherine, I'm not sure if there was anything else that you'd like to chime in and add, or if anyone has any questions, please feel free, as this is your open enrollment opportunity to ask any questions or get additional information.
The only thing that I wanted to add that if you are choosing to waive your benefits, please make sure to send in the waiver form and also proof of existing coverage, which could be a copy of your medical card and or a letter from the carrier.
Yes,
Yep.
very good. Very good.
Hi, this is Whitney Cohn. I actually had some questions about the waiver form. So, on the waiver form itself, like it talks about waiving your medical coverage, but then it also has a section like to waive prescription coverage. So if I'm waiving medical, how could I get prescription if I waive medical? Is that possible?
Under Direct 10 and under Direct 15, yes, because it
No,
is a
so I'm
standalone.
waiving, if I'm
Oh,
waiving medical
yes,
coverage,
yes.
how would I get prescription? Am I able to do that? Can I get prescription if I wait? Like I can get prescription even though I waive medical coverage?
I'll defer to Barbara and Catherine about that, but it is a standalone coverage, medical and prescription, because you have your medical through Horizon, you have your prescription through Benecart, so they are technically separate coverages. But I'll defer to Barbara and Catherine on that.
And I agree, they are separate coverages. I'll just have to check and make sure that our payroll system can accommodate for that type of employee deduction. So if you just want to send me an email,
Yeah,
then I can get back to
I
you.
did. You told me to listen to this thing, so I'm
Oh,
on
okay,
here listening to, and
okay,
nothing was covered on it, so that's why I'm
okay,
asking.
okay. So I'll
Also,
check with payroll and then I will get
okay,
back to you.
okay, but if I'm waiving medical, I also have to check waiving prescription, even though I'm waiving medical. Like,
No, on the waiver form,
yeah,
each
so
of
I
the
don't have
each
like
of
a
the
waiver form.
each of the boxes should be independent. So you could check whichever ones you're actually waiving.
Right, so if I'm only waiving medical, do I just check that, or do I need to check I'm waiving prescription also? Even though
No,
I'm not
that
getting medical through you? That's my question with the waiver form.
right. You're just going to check medical that you're waiving because you want to have prescription with us, correct?
No, I don't.
Oh, you don't? Okay,
I'm
then
not
you're
saying
going,
I want prescription. So like, I'm just trying to understand the waiver form. So you're telling me I have to check that I'm waiving medical and then I'm waiving prescription, even though I'm not
correct.
getting a medical plan. Like I wouldn't have, I guess you're saying I can get prescription without getting a medical
Exactly.
plan.
Right. So then you're
Okay, that
in
definitely was not covered in this little presentation here. So I have to check both. And then if I don't waive dental, this is nothing, like nothing on here today is about dental. It's just medical.
Really, yeah,
right.
because
Do you
there's only one dental plan, and you either want it or don't want it. So,
exactly. And
yeah.
Right, but it used to be like complimentary, like we used to not pay for dental.
that's still
So
the case.
that's still the case.
But
Okay.
we still
That's
have some people that waive it, even though they're not paying for it. They still
okay.
elect to waive it.
All right. That was very helpful. I just wanted to make sure I was filling out the form correctly. So thank you.
Yeah,
Okay.
and to Barbara's point, that is an important takeaway with regards to dental, which is a very unique situation we don't really see. But if, for example, you wanted to, the reason a lot of people, not a lot, but people who do waive dental, the reason they would waive it is because they would want their other coverage to be primary. Because if you have coverage through Mahwah and you have coverage, let's say, through your spouse, your coverage through Mahwah would be primary because that's where you're employed at. But if you wanted your spouse's coverage, for example, to be your primary, that would be a reason to waive the coverage through Mahwah.
Well, wait, can I ask you this then? So
Yes,
if I have coverage through Mahwah for dental, but my
yes.
husband gets it, wouldn't that become my secondary then? Like, wouldn't
That
I
be
still?
right, but you were asking, or I think I heard that why would somebody waive it if it's complimentary? That would be a reason why. If you wanted your spouse's, for example, let's say it has a higher calendar max, you may want that to be your primary, which is why you would waive it through Mahwah. But again, that's something that we really don't see. But that's why some people may choose to do it that way.
Okay, thank you.
Not a problem. Someone in the chat is asking, what's the best number to call and check about Benecard and whether or not about generic or original or preferred brand prescriptions. This is our office number, the 973-450-9800. You can ask for me. I am Elizabeth, but really any of our team members can help you with that. And if you call our office, most likely they're going to redirect you to me. But if you have a specific list of medications, believe it or not, I just did a research for someone who their spouse was on 23 different medications. I'm not exaggerating, 23. We looked them all up, and it was good that we did that because there were about 4 of them that were not covered under the educator's plan. They were pretty costly medications, and that was what made the decision for that employee to just stay in their Direct 10 plan. But you can certainly email us as well at the info@imacagency.com, or you can call, either way. But that's good that you're doing your research on that. Any other questions? And feel free to unmute yourself. We have a small crowd here. Okay. Well, as I said, the big takeaway is that December 3rd deadline. So I'll reiterate that here to go ahead and make any of your plan changes. Please make sure that you're submitting them beforehand just to make sure that everything is received on time. And feel free to reach out to us. We want to go ahead and connect with you one-on-one, especially if maybe you're considering maybe giving up coverage through a spouse and coming onto the district's plan. We have those conversations all the time with employees to compare the plan at Mahwah to what they have through a spouse to see what's a best fit for their medical and financial needs. So please reach out to us. But with that said, I thank you so much for joining us this afternoon. Very good questions that came up. And please feel free to reach out to us with any questions or even post-enrollment. If you're having a claim matter or a benefit question, reach out to us. We're here to help you. Thank you so
Yes, I
much,
just want to
Barbara.
say thank you. Thanks, Elizabeth. You
Yes,
did a great job. I appreciate you taking the time and, explaining all this to our staff. So I really wanted to say thanks.
perfect. Yes, I was going to thank you and Barbara for coordinating this with the district as well. So thank you so much. Really appreciate that.
Yeah, no, you're welcome. Thank you.
Great. Have
Thank
a good
you.
rest. Perfect. Great. Thank you. Have a good rest of your day, everyone.
You
Thank
too.
you.
Bye-bye.
Bye-bye.
Thanks. Bye-bye.